All right, I'm here at Omonia Cafe. It's April 18th, Good Friday, and didn't have a huge crowd today, but we did get a lot of interesting questions that I thought were worth kind of chatting a little bit about. All right, so the first one was, you have this decision to go on Social Security at 62, at full retirement, and then potentially at 70, right? And everybody understands that the longer you wait, the more you're going to make, or the more you're going to earn, or the more you'll be eligible to earn, right? But the question is, what if, for some reason, you feel that you want to go on early, but you're not fully committed to anything at any given time, right? So, in that case, what you're going to do in that case is, and many people do this, right? And so, let's say I go on at 62. I go on at 62, and I'm going to take 6 months to a year, and in that period of time, I'm going to be 6 months to a year. I'm going to be living with my daughter, right? And I know my costs are going to be a lot less during that period of time, and so I don't really need the money. Or I saved pretty well. I'm doing pretty well. I'm staying in my job. I'm working part time. I'm doing a bunch of different things, to kind of make some different kinds of income. Or the market has been very good to me, So in those cases, you can do something that kind of will raise your Social Security benefit, but not really make you fully committed to any specific age, right? And so you're 62, you go on it for 4 to 6 months, and something's changed in your life, and you don't really need the money as much. You pause it, right? You pause your Social Security. You can easily do it. You can go online and do it. You will. It'll probably take, a few weeks to a month to sort of see it take effect. But while it's paused, you are going to be not receiving payments, right? And so, and not only does it turn off, but they can't just turn it back on at your old amount, right? Because the way Social Security works is about what you've paid in and then what you're going to take out, right? And so as soon as you stop withdrawing money from Social Security, there's going to be a recalculation of your benefit, right? I would try to pause for as long of a period as you can, right? So that you can see a more sizable increase in your benefit. But if you paused it and you took sort of a staircase approach, which was, I'm going to go on it now, I'm going to pause it for a while, I'm going to go back on it, I'm going to pause it for a while, you can see a measurable increase in your Social Security. And so it's something I definitely recommend to people that have that flexibility. Now, one thing I will warn you about, which someone mentioned in our meeting today, which was, I heard that if I pause it, I have to pay the money back that I've already earned. And that is not pausing, that's voiding, right? So if I void my Social Security election in the first 12 months, you are required to pay that money back, and you get into a bit of I wouldn't say a sticky situation with the Social Security office, but sometimes you might feel that the amount you have to pay back is it's burdensome to you, and so I just be cautious of voiding. Right, voiding is an issue that we want to kind of just be careful of. The third thing that came up today, which was, why is supplemental G plans so expensive? And particularly I think in New York City and in any major big city, you get into this conversation about supplemental G plans. Supplemental G plans are really the kind of gold star plan, and I'll tell you why. Essentially, what a supplemental G plan does is it says you can go to any doctor on any plan anywhere in the United States, and only have to pay your Medicare deductible, which is roughly this year around $255, right? And so you pay a pretty decent sized monthly premium, um, and um, and after you've paid that premium, you have a deductible, like I said, of about $255 per year, and then you can basically have anything done whenever you want it done, um, as long as it's covered by Medicare. There will be absolutely no charge to you, right? So that's why we kind of consider, Medicare Part G plans kind of the gold standard. Uh, but in some places you might pay $300, $400, $500 a month for a Part G plan. So that flexibility of being able to go anywhere in the United States, if you live on the East Coast and you want a summer and you want a winter in Florida, it's an excellent kind of concept. But not everybody can afford that. Now, what I did find out very recently is I had a client in New Jersey who I priced out a Plan G for, and it was very cheap. It was Plan Gs in parts of New Jersey were, more like $75, $100, $150 a month, right? And so for me in New Jersey, in parts of New Jersey where you can get that kind of pricing on a Plan G plan, I think that's a very compelling case, right? And so I think the most important thing is to not get turned off by Plan G right away, and to think a little bit about what my options are, right? And geography can be a huge determinant. So think a little bit about that, and that's why it's important to talk to somebody about that. Now, what if you? Somebody asked me, what if you can't afford a Plan G? What are the other options? A lot of people obviously can't afford a Plan G, right? Because it's a very expensive plan. You got a few options, right? You can go to Medicare Advantage. A Medicare Advantage plan can be as low as $0 a month. Some of them may be a little bit more, depending on kind of additional benefits you might want. You could go to Plan N, which has a lot of the benefits of G with a few minor exclusions. So, I recommend taking a look at a Plan N. The third option, which is also very good, is to think about maybe going on a Plan G high deductible. And let me explain that to you. So a high deductible, I believe now the deductibles are in the high 2000s, up to maybe $3,000 on a high deductible Plan G. So what you end up doing is you end up paying a very small amount. I will just say roughly in the $60 to $100, $120 range a month. And as a byproduct of that, you now have a higher deductible. You don't get the $255 deductible. You might have a deductible closer to, like I said, high 2000s, and that's your deductible, right? So given that, so that might seem to you like, oh, I'm afraid of the deductible. I wouldn't be afraid of the deductible, and I'm going to tell you why. Because while you're healthy, you're saving in those years, right? Okay, so, I'm saving thousands of dollars a year when I'm healthy. And let's say I'm 65, and I want to have the comfort of knowing that if something bad happens, I'm going to have the coverage. Plan G is going to give you the coverage that you want. But on those good years, you're saving lots and lots of money. In the years where you really need it, and you're going to go into that deductible, there is not much of a difference. If you take that deductible and you divide it by 12, the difference in price for that deductible and a normal Plan G, it's pretty much the same. So Plan G high deductible plans essentially allow you to have a much effectively lower monthly cost. And when you need them, that cost goes up, but it only goes up for that period of time that you have that problem, right? So if you had, I don't know, if you had something that was sort of an acute condition, and it got dealt with, yes, that year you'll spend more out of pocket. But if you had been on a Plan G for the 5 years preceding that, you would have spent 4 or 5 times more, right? So I want you to understand that the Plan G high deductible really is a great plan, because what it does is it sort of lets you have the regular Plan G when you need it, right? And you don't pay for it when you don't need it, right? So I think that's a really important aspect to think about, and I highly recommend taking a look at that. Some of the other things that came up, I just want to make sure that we cover it. Let's talk about Medicare insurance salespeople, right? They're really called insurance agents, right? And so, and there's a broad spectrum there, right? And so I want you to be a little bit, not wary, but I want you to be prepared to ask a lot of questions. I want you to ask why. When somebody recommends something to you, you want to know why, right? If somebody says you need to go on this Aetna plan or this United Healthcare plan, the question always has to be why, right? And so I want you to understand why you're making the decisions you're making. Sometimes certain agents are more salespeople. Some agents are more, are really looking deeply into the plans and are able to communicate to you the basic, reason why. It's the same as with if you went to a financial advisor. Why do you want to put me in bonds? Why do you want to put me heavily in the stock market? What is the thinking there, right? And so, I think it's really critical that, as you kind of make these big decisions, to ask why. Don't get hung up on it. Don't make it the worst thing in the world, because you get to change your plans. You can change your plans throughout the year if you have the right reasons. And if not, you get to change the plan yearly. So, it's not the worst thing in the world to try a plan out. But I don't want people to pick plans because someone gets they've got some sort of sales commission benefit for it, right? You should know there should be a medical reason, a healthcare reason, something that's going to help you as an individual. There should be a reason that you're doing it, not just to get someone some sort of sales prize or a new car or whatever that is, right? So you want to definitely always ask why. Question came up around the stock market and what do all these losses in the stock market mean to Social Security? Well, the good news is it doesn't mean anything. Basically the stock market losses, you have a commitment from the federal government unless they cut that commitment. So you have a strong commitment to get that done, and so what really affects it is more consumer prices, the inflation. That will ultimately mean you will get ultimately a higher cost of living adjustment. So that's good for you. And if we stay with high inflation for some period of time and then it all goes away, you'll get that cost of living adjustment and it'll be a permanent stay. You might have future cost of living adjustments be minimized. So that's something to kind of keep in mind. But the good news is you're not going to be impacted by too much there. And the last one was, what is the real difference between Medicare Supplemental and Medicare Advantage? And what we talked about there, which I think is a very important kind of concept, is that, flexibility really goes to Medicare Supplemental, right? No doubt, if I wanted a Plan G, I can do whatever I want. I make all the choices. I have no restrictions. My only restrictions are, what Medicare will and won't pay for, right? And so, that's a very clear kind of decision and thought process. Now, The downside of Medicare Supplemental is it's costly, and it doesn't carry dental, and it doesn't carry vision, and there aren't any extra perks, right? With Medicare Advantage, you get some extra perks, right? It's very simple. Whatever Medicare pays for, it will pay for, and you have very little out of pocket if you have a Plan G. And as you move through some of the other plans, you'll have more and more costs that you'll have to share with those supplemental insurance companies. Medicare Advantage, on the other hand, is the idea of pooling lots of people together and creating a plan that will allow them to provide the bare minimum of what Medicare requires, and then offer additional benefits. So what you'll often find is that they'll give you, in the beginning they used to give you just preventative dental, preventative vision, but what we're seeing now is you get a little bit more dental coverage. Some of them will give you up to $1,000 worth of dental coverage, of comprehensive dental coverage, which means like cavities and root canals and all that kind of stuff. Some will give you a little bit more. You might get up to $2,000. You might get a gym membership through like something like a Silver Sneakers, and you might get some additional benefits. You'll find that you'll get co-pays throughout the coverage model. So what that means is, you'll have some cost sharing. Perfect example would be like maybe a CT scan, right? You'll have some cost sharing on a CT scan or a blood work, or any of those types of things, right? It's pretty small, in comparison to what the actual cost of that is. But I think the biggest, the last upside is, you can get a Medicare Advantage plan for $0, right? If you want more benefits, you want more coverage, you might pay, another $10, another $20, another $50, maybe $100 at the high end, or a little bit more than $100, right? But on the negative side, it's going to work like a company insurance plan, right? You're going to have a network, and you're going to only be able to go to the doctors in that network. I just shopped a plan for a customer, and he had to make some pretty tough decisions because, when he looked at all the plans that were available to him in his area, he had a long list of doctors. He had maybe 10 or a dozen doctors, right? And so with his situation, he had to decide who was the critical doctors that he was willing that he had to have, and who was he willing to sort of give up and go to an in-network doctor, right? And so he had some choices, and so he had one plan that had a very high number of his doctors. It wasn't all of them, it was about 80%, but he wasn't comfortable with that insurance company, and didn't love the rating around that insurance company, so he ended up going with somebody who had around 40% of the doctors that he wanted. His primary was in that 40%. And so he was willing to reshop for some of the other doctors, right? And go to the in-network plan. So he went with a big provider that he felt more comfortable with. And as a byproduct of that, he had to make some pretty critical decisions about, his health care and who was going to be a provider for him moving forward. So, to me, so that's kind of definitely a downside, is the in-network component. If you go out of network, it's going to cost you a lot more money. The maximum out of pocket is quite high on a Medicare Advantage plan, particularly a $0 one. It can be, $8,000 to $10,000. So that's kind of a negative. The co-pays you're going to have to pay every time you go somewhere, some component. It's pretty small. It's not a big amount. And if you have one good thing is, if you're in a Medicare Advantage plan and you live bi-coastally, or you live half the year on the East Coast and half the year in Florida, if you go with a big plan, you will find providers wherever you are. So that's also very good. Okay, but that's all we had today in Queens here at the Omonia Cafe. Please feel free to join me later for more. Thanks.